even after you graduated, did 2 years of residency, you still decided to get a certification afterwards, which is, I feel like, was also the standard for the pharmacists we both saw
Yes.
in our practice, our rotations. So tell us a little bit about your certification and why pharmacists might choose to get certified afterwards.
Sure. So after residency, I decided to do the BCACP, so the Board Certification for Ambulatory Care Practice. I don't know if those letters align, but that's what it is. So with that certification, you're now board certified in this specialty area. And the BPS is an organization that certifies pharmacists. So you take an exam, you pay a lot of money, you do a lot of continuing education to have some extra letters behind your name. For me, and again, it was one of those things where when you're looking at jobs, when you're in residency, you can see what the requirements are. And a lot of the preferred candidates had board certification. And like you said, a lot of the pharmacists that I worked for had board certification. So it's like, okay, they did a residency, they did board certification,
Yeah.
and now they're getting to do all these cool things kind of autonomously within the scope of their practice. And so that kind of drove me to want to do that as well, kind of follow in those footsteps, get board certified. That kind of, you're now the expert kind of within that field. And then you're required to, like I said, do continuing education. So like as new drugs come out, as new therapies come out, as guidelines change, you're kind of required to stay on top of that. And I appreciate that pressure to kind of be on top of things through not only just, for yourself, but through that certification. But I will say that it really was like, jobs want this, and so I'm going to have it.
So it makes you more competitive.
Definitely.
It can also help you negotiate your salary. Not a lot, but it's a little something something. But it also, what I found was that it felt like I was studying for my boards like all over again, and stuff that I haven't even seen since I was in the classroom or studying for the NATPLEX. I was having to sit in front of again. So I'm certified in pharmacotherapy. So that's more inpatient driven,
And
I
I
would
feel like
say.
that's more umbrella, like it encompasses more
It
topics.
does, because it had me studying
You did like some oncology stuff,
fluids,
right?
yeah,
Yeah.
fluid resuscitation, oncology, and I'm like, what is happening? I'm primary care. Like, what's happening? So that was a lot, and it was like, oh my goodness. It reminded me why I chose to do like outpatient. But it was a lot. But I really appreciated having to see all that stuff again. I feel like it kept me sharp. And now that I'm going to kind of have to make sure I'm staying on the my A game by the continuing education, because it's an addition to the continuing education. You need to keep your license active through the state. It doesn't add on, unfortunately.
No.
It's a separate entity of continuing education. So the state that you're licensed in will have different parameters or different areas that you need to get your continuing educations in. Like some will require 2 to 4 hours of vaccination, and for example, whereas for the board specialty, it's going to be more focused to the clinical niche that you are specialized in. So I think that's going to be helpful. Now, do you think that you're going to go back and get certified in diabetes, because that's its own
Right.
certification?
So I go back and forth on this often. So one of the things I said I would want to do is do the BCADM, which is a board certification for advanced diabetes management. So that is something that I'm considering. What I will say though is that I'm already doing all of the things for that certification in my daily practice. So I could pay money and take another exam to have more letters behind my name, or I can just continue in my current practice without the extra letters behind my name and save hundreds of dollars each year. So that's kind of where I'm at. But I do think that the extra certifications just kind of give you more education, and I'm all for that. Like I love learning new things. I love going to conferences and networking with people kind of
Yeah.
in the same, excited about the same things that I am. So undecided, to be determined.
Yeah, I think you make a good point because, for example, if the role was already established and they were looking for now a new lead diabetes pharmacist to come in, they might want, I'm pretty sure they would want them to have that certification on
Mm-hmm.
board now
Mm-hmm.
that it's already been established. But you came in and you birthed it into what it is and you grew with the program.
Mm-hmm. Without that certification.
So let's talk about that component for people who want to get into an area, but they're like, well, I didn't focus on this in my training. Like, I
Mm-hmm.
don't know if I can excel in that job if and it's specific if that's not what my training is in.
Mm-hmm.
Because you had diabetes along the way, but it's not something that you like laser focused in.
I feel like when you're a student and you're a resident, you're not specialized, right? Like as a student, you're wide scope, needing to learn a little bit about everything. As a PGY1 resident, again, it's not as focused. It's more broad. Some of them can be more focused. I know yours, you didn't have any inpatient. I didn't either.
Mm-hmm. Yeah.
Just based off of the residency, PGY2s are more specialized, and that does kind of hone in the disease states that you're focused on, and more so where the patients are. It's like the patient population, because you're going to have patients with diabetes in the hospital and outside of the hospital. In terms of, specializing or picking a specialty, one of the things I was always worried about was that if I spend so much time on one disease state, I'm going to forget everything about everything else. And that's why I really liked ambulatory care, because you see most patients don't just have one disease state. They have multiple.
Yeah.
And so you get to kind of see that all day. And if you're seeing 8 patients a day, you're seeing a lot of different disease states. A lot of them are the same, but you're, getting to, see a lot of different things. When I was doing my PGY2, I was really interested in HIV, infectious diseases. That was something that I had a lot of exposure to in pharmacy school, and then I had a really great rotation in residency. But I also felt the same about diabetes. I had a really great year-long rotation as a PGY1. PGY2, I didn't have as much exposure. So when the opportunity came up, it was like, I can do this. Residency and pharmacy school really draw out your strengths. And like, if you're someone who likes to learn, and if you're someone, that knows what your resources are and where to go to find them, you can specialize in anything that you want to.
That's really good advice. Yeah. That's what I tell the students that I was precepting back when I used to precept, sad face. So I would be very careful about making sure that they didn't feel bad for not knowing certain things, because I just remember feeling that way. Like if I didn't know it on a rotation, like I felt stupid, or I felt like unworthy of being there. Like I was like ashamed that the preceptor had to explain certain things to me, and I had to give, me being the type of learner who I am, where I have to see things, I would say, more than my peers did. I would have to study. I would have to put in more time and hours more than my peers did. And sometimes I wouldn't even get like the same grade as them. But when it would come to interacting with a patient and communicating with a patient, that's where my strength was. So you may beat me on the textbook, but you're not gonna beat me in the clinic or when I'm talking to that patient. And so I had to draw on my strengths, and I had to fall back on my training. And so I tell my students who are like, oh, I remember seeing this, but I don't remember. And it's like, that's okay. Like, as long as you know where to look it up, and then as you keep seeing it repeatedly, like you'll remember it naturally. But you have to hone in on your strengths.
I agree. Nobody knows everything. Yeah. Like I work with diabetes every single day, and there's still some things that I don't know, right? Like there's things I never heard of until I hear it for the first time.
Yeah.
And one of the things that I always say, and just to echo your point, is like, if you know where to go to look things up, that is all I can ask for. From a student, from a resident, from another pharmacist, look things up, know where to go to look things up. Like, are you on Google, or are you on PubMed, or are you on UpToDate? Like those things matter. Like, know what your resources are, know which resources to use.
Yeah.
But it's okay to not know everything. Nobody knows everything.
Yeah, nobody knows everything. So give yourself some grace.
Mm-hmm.
Man, I still use my board certified, my BPS book that I was studying from because that's just like a wealth of
Mm-hmm.
information. It feels like the Natplex upgraded,
Yeah.
like the big girl Natplex edition. I love using that book as a resource.